Shade selection and aesthetic considerations. Life isn't black or white, it's all sorts of shades of grey. Introduction. To provide aesthetic restorations to the patients, the dentist must understand the scientific as well as artistic basis of shade selection. To accomplish this, a thorough knowledge of the concepts of color and light is necessary with clear communication to the laboratory. What is color? Mair and Salzman defined color as the result of the physical modification of light by colorants as observed by the human eye and interpreted by the brain. Light is physical, colorants are chemical, eye is physiologic, brain is psychologic. Absorption and reflection of light. A red object reflects red and absorbs other colors of white light. A white object reflects all colors of white light equally. An object is seen as black if it absorbs all colors of white light. What is color? The entire process originates with the light source, hence the statement, light is color. The source of all colors is white light. This is the color wheel, which represents primary, secondary, and tertiary colors. Additive color synthesis, subtractive color synthesis. Are white and black colors? In physics, a color is visible light with a specific wavelength. Black and white are not colors because they do not have specific wavelengths. Instead, white light contains all wavelengths of visible light. Black, on the other hand, is the absence of visible light. History of colors. Sir Isaac Newton described colors in 1672. In 1905, Professor Albert Munsell described color. In 1929, Munsell Book of Colors was published. 1930s, Dr. Bruce Clark. 1960s and 70s, Dr. R. Sproul, Dr. J. Preston, Dr. S. Burgeon, Society of Color and Appearance in Dentistry. 1970s and 1980s, Dr. John McLean, Mr. Willie Geller. 1976, CIE Lab. 1990s, present, Dr. Stephen Shu, Dr. Galip Gurel, Dr. Pascal Magne, Phil Mayer, and Salzman. Sir Isaac Newton. Our modern understanding of light and color begins with Sir Isaac Newton and a series of experiments that he published in 1972. He refracted white light with a prism, resolving it into its component colors: red, orange, yellow, green, blue, and violet. Professor Albert Munsell. He described the Munsell color system. Munsell color system, developed by Albert Henry Munsell in 1915, the system describes color possessing three dimensions: hue, chroma, and value. This is the Munsell system. Hue, color tone, the actual color. It is a particular variety of a color, often referred to as the basic color. Hue is used to distinguish one family of color from another: red, green, blue, as described by the wavelength. Chroma, saturation, purity of the color. It is the intensity or saturation of the color. The chroma scale starts from achromatic or 0, with increasing values indicating stronger color. A particular color is classified as weak, moderate, or strong according to chroma. Value, relative lightness or darkness of the color. It is the brightness or the relative amount of darkness or lightness in the hue. It is an achromatic or colorless distinction. Black is 0, white is 10. Colors with low values are dark, while colors with high values are light. For shade matching, value is the most important characteristic. This is the value. The other color systems are Oswald color system, Prester-Pran color wheel, CIE lab. The CIE lab is a color space specified by the International Commission on Illumination. It describes all the colors visible to the human eye and was created to serve as a device independent model to be used as a reference. The three coordinates of CIE lab represents the lightness of the color. L equal to 0 yields black. L 100 indicates diffuse white. Specular white may be higher. Its position between red or magenta and green. A negative values indicate green, while positive values indicate magenta. And its position between yellow and blue. B negative values indicate blue and positive values indicate yellow. CIE lab, SCAD, Society for Color and Appearance in Dentistry. The Society for Color and Appearance in Dentistry was founded in 2008 as a consortium of dental professionals and other experts interested in this area of aesthetic dentistry, specifically related to scientific investigations and applications of color and appearance in dentistry. Dimensions of color. To accurately describe our perception of a beam of light reflected from a tooth or restoration surface, 3 plus 1 must be measured or studied, which includes hue, chroma, value, and translucency. Hue describes the dominant color of the object, refers to dominant wavelengths present in the spectral distribution. The Vita shades depicts 4 hues: A for reddish brown, B for reddish yellow, C for grayish, D for reddish gray. Chroma, it is the dimension of color that defines the intensity or concentration or degree of saturation of the hue. In teeth, it is dictated by the dentine and influenced by the translucency and thickness of enamel. Value, it is a relative blackness or whiteness of color, quantitative and not the quality of color. On a scale of black to white, white has high value, black has low value, and midway between the black and white is medium gray. Value difference are more noticeable and thus have more relative significance in a dental restoration than hue and chroma. Variables affecting color perception. Observer factors, which includes age, experience, fatigue, color vision deficiencies, eye dominance. Lighting conditions, illumination, type, intensity, angle, time of the day. Object properties, tooth's translucency, opacity, gloss, subsurface scattering, presence of moisture. Illumination, light intensity, and light quality. Incandescent light, 2856 Kelvin, fluorescent, 4000 Kelvin, color-corrected light, 5500 Kelvin. Factors affecting illumination, metamerism and lighting conflicts. Metamerism can be recognized and explained but not corrected. In some situations, a restoration might not match as well as in some others it might match. This is an occurrence and not a fault. Also, a single restoration might require a remake or two to get it right. Light sources. Shade determination should be performed under color-corrected daylight lamps, which contains a balance of the entire visible spectrum. The operatory should be lit using a luminous ceiling with translucent diffusing panels that are simple to maintain. Clean watt saver lamps having a color temperature of 5500 Kelvin or higher is advocated. Shade selection made using daylight is also a possibility, but daylight is subject to constant changes, preferably not under operation lamps. Key aspects of ideal light for shade matching. Indirect lighting with light sources at 5500 Kelvin color temperature. Color-corrected light with a full visible spectra range. Enough intensity to eliminate ambient light, but not so strong as to mask the color difference. Pleasant to the eye in order to deter fatigue. Consistent in that it does not change depending on time of day or location. Light source. The bulb should have a CRI, color rendering index, above 90. The range is 1 to 100. A standard cool white fluorescent lamp, for example, will have a CRI near 62, whereas natural sunlight has a CRI of 100. The score represents the light source's ability to reproduce the full spectrum of visible light. The higher the CRI number, the better it will be for shade matching. Measures to be taken. Diffused color corrected lights of 5500 to 6500 Kelvin. A light source having CRI of at least 90 or above. An ideal light source for shade matching is one that is diffuse and comfortable for the eyes, allowing observers to assess the color accurately and comfortably. Use of digital shade matching aids. While matching hue, chroma, and value, use 18% gray cards or Culser's intraoral gray cardboards or pink strips can be used to eliminate the contrast error, and it must be used as a standard protocol. A gray card is a flat object of a neutral gray color that derives from a flat reflectance spectrum. Basic guidelines for shade matching. Patient should be draped with a neutral color drape, preferably blue or gray. Remove all colors, contrast colors. Clean the teeth and remove all stains and debris. Leave the tooth hydrated. Have the patient's mouth at your eye level so that the most color-sensitive part of the retina is used. A viewing working distance of approximately 10 inches should be adopted. The patient should be reclined at a 45-degree angle. Shade guide tabs should be applied parallel to the tooth, never in front or back. Determine shade at the beginning of the appointment to avoid ocular fatigue. Give it a 5-second gray rest. Shade comparison should be performed at 5-second intervals so as not to fatigue the corn cells of the retina. The operator should rest his or her eyes between viewings by focusing on a neutral gray surface immediately before each shade matching, because this balances all the color sensors of the retina. Obtain value levels by squinting and comparison made at arm's length. Squinting causes the black and white sensitive rods in the eye to become more active, diminishing corn sensitivity. The rods are responsible for helping to determine the value. The tooth fading first has the lower value. Compare shade under varying conditions. Also compare shades under varying lighting conditions and method. For example, wet versus dry lips, retracted versus pulled lip. Use the canine or the middle third of a tooth as a reference for shade, because in most cases, it gives you the highest chroma of the dominant hue of the teeth. 70mm mouth opening view is important for shade matching. Teeth should be dry when evaluating value, translucency, and surface texture. These should be wet for evaluating hue and chroma to limit the influence of surface morphology. If unable to precisely match shade, select a shade of lower chroma and higher value. These are the available shade guides. Thank you.